Hi, my name is Mark Palumbo. I'm an orthopedic spine surgeon working with University Orthopedics in Providence, Rhode Island. My specific subspecialty area within orthopedic surgery is spine surgery, and in particular, my practice is focused on the treatment of spinal diseases and disorders in the adult patient. To me, spine surgery is both the most challenging and the most rewarding subspecialty area within orthopedics. Our patients, or our spine patients, are many times afflicted with life-altering and sometimes life-threatening disorders, and the ability to be part of the process to restore them to well-being is, highly gratifying from a professional standpoint. Certainly the spine field is constantly moving forward. There are all types of new technologies. As a group, we're still working through the correct applications of many of the new technologies and are still in the process of verifying the advantages of new technologies. But having said that, there are a number of ways we're treating the spinal column surgically that are much more advanced in terms of technique than things were 15, 20 years ago. Surgeries and operations we did in the past that were done through large incisions and required protracted recovery times in the hospital and afterwards are being modified so that we have less invasiveness to the procedures, less trauma to the individual patient from a surgical standpoint, and that's allowed us to manage many diseases in a more efficient fashion for the patient. They can get through their hospital stay quicker with less discomfort and with a more rapid restoration of functional. The reality is that the vast majority of individuals with spine problems can be treated without surgery, and that is our focus here. I mean, we're a very conservative group of spine surgeons that try in every way possible to get people back to health and life and function without surgical intervention, and the physical therapists here at University Orthopedics are a critical part of that process. That is one of the true advantages of working here with University Orthopedics. It's that integration of care both across the group of physicians and then in collaboration with the physical therapists, the occupational therapists. I mean, they're here on site, they're high-level, accomplished physical therapists, and they communicate with us directly on a regular basis. So if someone's not making the progress they should be in physical therapy, then I know about it immediately. We can adjust on the fly. I think there are a lot of advantages for an individual seeking medical care in terms of coming to University Orthopedics. My personal opinion is that the greatest advantage is my access for the welfare of my patients to a group of highly accomplished clinicians and surgeons. I think we really provide the highest level orthopedic care in the greater New England area. Many of our physicians and surgeons are scholars, they're teachers, they're researchers, they're on the cutting edge of their fields, along with being excellent clinicians. The affiliation with Brown University, and I'll loop into that Rhode Island Hospital as well, because Rhode Island Hospital is the primary teaching facility, if you will, for the Brown University medical system. To me is a huge advantage in my practice. We have world-renowned experts, regional physician experts, if you will, that can provide the highest level of care, and to me they're at my fingertips. I don't think I could operate my practice efficiently and with the highest level of safety anywhere else except this institution. Another example of more of a newer technology treatment that we can offer in spine surgery is exemplified by a very nice young lady who I recently took care of. We'll refer to her as Roxanne. That's her real first name. She happens to be a very personable, active, physically active woman who owns and operates a farm where she raises horses and trains horses. And she developed a problem known as a disc herniation in her cervical spine, or her neck, which produced pressure on one of the nerves going to her arm, and that resulted in severe pain in the extremity along with weakness and dysfunction, and these were things that were obviously life-altering, at least with respect to her work situation. So she elected to undergo an operative treatment which consisted of removing the herniated disc and removing the pressure from the nerve structures in her neck, her spinal cord and her nerve roots. And that was done through a small incision in the front side of the neck. That part of the operation was done to relieve the nerve problem she had, the severe pain in the arm, the weakness in her arm. Following that component of the procedure, we need to reconstruct the spine or rebuild the area where we perform the surgery. And that, in her case, given her youth and her high activity level, we utilized a newer technology called cervical disc replacement or cervical disc arthroplasty. It's what's called a motion sparing reconstructive technique, very similar to what most people understand in the extremity joints, a hip replacement, a knee replacement, where instead of fusing the joint, making it stiff, we reconstruct the joint but maintain its mobility, maintain its function. And it really ended up with an excellent outcome for her. She has maintained all her range of motion. Her arm pain and weakness have completely resolved, and in some ways, against my advice, she returned to work and physical labor, if you will, very quickly after this procedure, and has continued to do so over the past year. And I recently spoke with her, in fact, this week, and she was going to join us today, but was on her way to a horse show in Springfield, Massachusetts. And spine surgery can be challenging at times, and we don't have a perfect solution for every problem, but certainly for an individual like Roxanne, when you're able to eliminate someone's pain and really restore them back to what they consider their normal life, it is absolutely the greatest draw to orthopedics in general and to spine surgery in particular. And it's what keeps you coming back as a surgeon. We have difficult days, we have good days like any profession, and it's really the primary draw that kind of keeps you rolling forward and gets you through tougher times, but really keeps you coming back to try to help people.